Okay, can you see the screen, student?
Yes, ma'am.
Yes, ma'am.
Okay, we were on this topic now. What to do if the victim is not breathing? So let us revise once again. When the victim is not breathing, or if his breathing pattern is not normal, it might be the breathing pattern is too fast, or it is too low. At that time, we have to try to remove any causes of suffocation. And if the person is not in his back, we should try our best to turn him on his back, and then we have to kneel down on the side of the patient or on the side of the victim, because he is not breathing now, so we always need to be beside him. And then we have to start CPR. So while starting CPR, there are some points that you need to remember. Do not interrupt the resuscitation until the victim start to wake up. So until the victim start to wake up, we should not interrupt the resuscitation. Continuously karna hai. Okay, and until he wake up, until he move, open his eyes, and until he breathes normally, we should not interrupt the resuscitation. And the other one is we should not interrupt the resuscitation until the helps, that is the trained CPR, arrive and takes over. Okay, that means like we will, like if you are also like trained, but like you have a little bit knowledge about CPR and you are continuing the CPR, but when the expert one, when the doctor or the physician, the expert one, when they until they arrives and takes over na, you should not interrupt the resuscitation. कोई लोग CPR का बारे में थोड़ा knowledge होता है, so in the emergency condition, तो those people are also can be considered as a first aider na, they are also helpful. थोड़ा सा knowledge होने से they are helpful. But when totally the trained one arrive, until he or she arrive, you should not interrupt the resuscitation. You will continue. Are you clear, all of you? Yes,
Ma'am.
Okay. Do not interrupt the resuscitation until you become too exhausted to continue. Means like resuscitation, CPR, date, until and unless you become exhausted, okay? Exhausted to continue, keep doing. You have to keep performing. जब तक तुम exhausted ना हो जाती. What is exhausted?
No energy left, ma'am.
Yes, very good. Okay, so until you become in that conditions, you have to, like, you should not interrupt the resuscitation. Okay, and do not interrupt the resuscitation until the scene become unsafe for you to continue. Because when you see the patients now, when you see the casualty or the victim, okay, his condition, when you see that until he become unsafe for you to continue, okay, you are feeling that like, oh, the thing that I'm performing, this is unsafe, so I should not continue it. If you had a feeling that, then only you discontinue it. Okay, you have to discontinue it. But until that, until you find that it is safe, you should not interrupt in between that. Are you clear? What you need to do when the victim is not breathing, or if his breathing is not normally?
Yes, ma'am.
Okay. Next. If the breathing start again, we have to cover the victim and arrange urgent transport to a hospital. Do not leave the victim alone and continue to observe him. Means all this means that you are giving CPR, right? क्योंकि वो तो breathing, उसका breathing नहीं हो रहा था, तो you are giving a CPR and you find at the end or at the last you find that he started breathing, his breathing started again. Then what you need to do, what step you need to take is that you have to cover the victim, okay, and then immediately arrange the transport to the hospital, okay, and then do not leave the victim alone and continue to observe him. And if the breathing stop again, then restart CPR. Are you clear?
Yes, ma'am.
Okay, this is very simple and like it is very, very easy to understand. Okay. Okay. So are you clear that much about the drowning topic? What you see? Let us revise what this is the drowning. This revision was already done. This was your aim. There were 3 aims, and what you see and what you inquire. This was a thing, and then what you need to do, all these things, and then what to do. First is you have to first safety and call for help. Later on, now we have to remove the victim from all these things. And if the victim is breathing, what you need to do. If he is not breathing, or if his breathing is not normal, what you need to do. And by giving CPR, after CPR, giving CPR, if his breathing start again, what you need to do. Are you clear this much? Whatever we have discussed about drowning?
Yes, ma'am.
Okay, with this, like we will close the topic of drowning. Okay, and it is not over. I will discuss on my next class about the drowning topic, and my next class I will complete the drowning topic. So now you can take out your practical copy. Okay, the practical copy means the practical copy of first aid. So what was the last point that I have taught you was? I think I have even sent a note also, I guess. Tell me, one of you. Tell me one of you. Already the day I sent Asphyxia and this CPR notes ना. CPR का notes मैंने send किया था ना. उसका definition लिखने को बोला था, उसका purpose लिखने को बोला था, indication लिखने को बोला था. उसके बाद, yeah, that much we have discussed. And apart from that, I have given you all some something to write now while I was dictating. So that PDF will not be provided. So have you written all of you while I was dictating that day?
Yes, ma'am.
Yes, ma'am.
Okay. So what was the last point that you have written? Can anyone tell me? Stacy, what was it? Just open your copy and tell me. That's all.
Epilepsy, ma'am.
Epilepsy. Okay. Was there any topic or any heading or what was?
Causes or conditions that affect air passage, ma'am.
Pardon? Can you please read again?
Conditions or causes that affects the air passage.
Oh, the conditions that affect the air passage. Okay. Okay. Have I given you all this one? Like this one. When there is only one rescuer.
Yes, ma'am.
Okay, can you please read out that line?
When there is only one rescuer, interrupt compression after every 15 compressions to give to quit deep lung inflation.
After that? After that?
No.
After that, write full stop and you continue after that. This result in a cardiac compression. Can just continue that one. This result in a cardiac compression to the ventilation ratio of what have you
Can you
written?
repeat, ma'am?
Okay, you write this result in a cardiac compression to the ventilation ratio of 15:2. 15:2, because you have to give now after every 15 compression, okay, in order to give 2 quick deep breath lung inflation. So the ratio is 15:2. Pink Robiang, please repeat. Oh, okay. Okay, this is the last time I'm repeating. These result in a cardiac compression to the ventilation ratio of 15:2. I have told you all to write now that when there is only one rescuer, interrupt compression after every 15 compression to give two quick deep lung inflation, full stop. These result in a cardiac compression to the ventilation ratio of 15:2. Can you follow me, all of you?
Yes, ma'am.
Yes, ma'am.
Okay. So those are the basic points. So when there are also some like important things that you need to know. Okay, like while giving a CPR, okay, do you need to use pillow? Pillow. Pillow पता है ना सबको?
On the head, ma'am.
Actually, when you are giving CPR to the patients, now you are not allowed to like use this pillow. Okay, the patient should totally lie down on the ground or on the hard surface or wherever surface it is like appropriate for the patient to lie down. Okay, you have to place the patient back on his back without any pillow. Remember that. Because this position will help the patient in maintaining the airway, okay, while you are giving external cardiac compression. When you will give CPR ना cardiac compression, जब पिलो नहीं रख के directly वो ground floor पे कहीं पे भी like hard surface पे जब patient रखोगी without pillow direct, तो like head को direct back side में रखोगी, at that time like वो airway maintain करने में help करता है, जल्दी airway maintain करने में, compression देने का time पे. Okay. Okay, so you can write down the heading, preparation of the patient and the environment. Preparation of the patient and the environment. Preparation of the patient and the environment. क्योंकि CPR देने का आगे prepare करना है ना patient को, तुम देने का आगे तुमको prepare करना है. So whenever you perform any kind of demonstration ना, what are the first thing you need to know? अभी मैं बोलूंगी कि BP का demo दो तो what will you do? First of all, what you will try to have beside you?
Sphygmomanometer, ma'am.
Yes, and sphygmomanometer comes under what? Articles, right? So, सबसे पहले तो always remember that we should always, you're going to hospital, okay? Then you are asked to give the demo of BP. So your first intention be go and take the history of the patient. Patient का history लेना है, patient का साथ जाके बात करना है. Naam, age, father name, mother name, like the address, everything you will find out. That is always the first step. Then after that, you will tell him that what step you are going to perform. क्योंकि direct patient का हाथ लेके तो नहीं कर सकता ना, तो you have to like you have to tell the procedure what you are going to perform to the patient. That is the thing you always keep in mind when you go to hospital. Okay. Then the other one is that now you already informed the patient what you are going to do. Now you will be like performing now. Okay. So you have to prepare the patient now. Agar BP dena ho to like the patient will lie down na. The patient will lie down. To lie down hone ke liye to bed chahiye. So all those things. So the patient is already lying down or in a sitting position, whatever it is. Then after that, the next step is now you will try to take the BP. So now to take the BP, you need to have articles. तो BP लेने के लिए क्या क्या articles चाहिए? मैंने जो list में दिया था ना, बहुत सारा articles, thermometer, stethoscope, सब कुछ वो एक tray में रखना है, everything. So after that, whatever you want to demonstrate, then only you are able to perform. So in the same way, when you are trying to do CPR, you have to first prepare the patient, okay, and you have to see the environment also, like the environment is too suffocated or not. All these things you have to like make preparation first. After making the preparation, you have to check whether the articles that are needed to give CPR are available or not. Okay, if everything is available, then you will go to the step. Are you clear? This little bit basic information. Are you clear?
Yes, ma'am.
Yes, ma'am.
हमेशा दिमाग में रखना ये सब चीज, like no one will tell you in your ever entire life, because these are just the basic thing. Every people will think that oh ये तो सबको पता है, but many people don't used to know ना. So just keep in your mind all these things. So when we prepare the patient and the environment now for the CPR, okay, no time used to be lost, not even a single time, not even a single minute or a single time is lost. You just listen, I'll give you all the notes, no need to write down. So no time used to be lost, okay, while explaining the procedure to the patient or his relative. So jaldi jaldi bolti ye wo ye karna hai bolti, okay, or else suppose I'm going to perform the CPR, then if I don't have time, then I will not even inform the patient or the patient relative that I am going to perform this. If someone is free, then I will let that person explain in a simple language, okay, to the relative, okay, or else I will ask them, the relative and all, to leave the room, okay. Why I will tell them to leave the room? In order to lessen the distraction, okay, and to provide more space to the rescuer to walk. So because the rescuer will walk now by giving compression, because so many patients are there, then so many people are there, then the room might be suffocated, okay. So that is the thing that you need to keep in mind, okay. Next, and always remember, the patient need to be shifted to a hard surface or a hardboard. If hardboard is available or if hard surface is available, then you have to shift the patient. क्योंकि हम बिस्ना में जब सोते हैं तो we used to sleep in the sofa or whatever it is, mattress, or it is soft na, so that particular mattress or whatever is not preferable for giving CPR, so we prefer the hard surface. So always remember this, okay. And we used to place the hard surface, or if hardboard is available, then hardboard is placed under his or her thorax, used to be placed. So this will help in the better, like better smooth functioning of the procedure. Are you clear? Are you clear?
Yes, ma'am.
Okay, this is how you need to prepare, okay. Keep in mind. Next, what you need to prepare? You need to remove or push aside the cloth which cover the patient's chest, okay. So you have, if cloths are available near the chest, then you need to try to remove, or else you just push aside the cloths, okay, which cover the patient's chest. So why you need to do this, that also you need to know. You need to do this in order to observe for cardiac beats and respiration. क्योंकि जब हम सांस लेते हैं तो our chest move ups and down, is not it? So you have to observe for cardiac beats and respiration. That is why we have to remove or push the cloth aside which cover the patient's chest. Are you clear, all of you?
Yes, ma'am.
Yes, ma'am.
Okay, and the next preparation step is the one that I told you all, that place the patient back on his back without any pillow. ओके बिना पिलो में रखना है उसको. क्यों? क्योंकि एयरवे को मेंटेन करने में हेल्प करता है, और जब हम एक्सटर्नल कार्डियक कंप्रेशन देते हैं तो इट हेल्प्स इन मेंटेनिंग द एयरवे, लाइक एयर को, लाइक ब्रीदिंग पैटर्न को ज्यादा लाइक वो सांस लेने में, जल्दी सांस लेने में वो हेल्प करता है. ओके, सो इफ टाइट क्लॉथ्स आर अराउंड द नेक, विल यू रिमूव? नेक बोला मैंने अभी, चेस्ट का खत्म हो गया. If tight cloths are around the neck, okay, will you remove?
Yes, ma'am.
Yes, very good. That is also how you need to prepare. Done. Next. And also now we were talking about the environment also. Now we have to ensure fresh air in the room. Okay, so fresh air लाने के लिए room पे हमको क्या करना चाहिए? You are in the hospital or in any condition or any room or whatever it is. क्या करना चाहिए? Fresh air को लाना है.
Open the windows, ma'am.
Yes, very good. We have to open the windows and the doors so that we can ensure that fresh air are coming, and that will help you in the smooth functioning of the process of CPR. Okay. And then always remember that this external cardiac massage, that is CPR, we should always try to start within 4 to 6 minutes. Okay, following cardiac arrest, or like because this oxygen deprivation, okay, can occur very easily. That's why. So that one I already gave you all that day, so that if you don't write also no problem, that one. Okay, now you already know now how to prepare. Now tell me, one of you, Carly, can you please tell me what are the what are the procedure, how you can prepare the patient for this, the procedure of CPR? Just tell me.
First, lay down the patient on his back.
Okay.
The surface should be hard and not soft.
Okay.
And then remove any restricting clothes on the chest and neck area, ma'am.
Okay, very good. Okay, so but if the relatives are available, what you need to do? Suppose you are in very hurry to give CPR, you are not free. So will you tell someone to explain on behalf of you in a simple language?
Can you repeat, ma'am?
Okay, if someone is suppose you are going to give CPR to someone, okay, and you are in very hurry to give, you don't have time to explain to the patient relatives. So will you request someone else to explain to the relative in a simple language?
I lost your voice, ma'am.
Oh, I think actually now my network is poor. I think like it's written unstable. Okay, okay. Okay, no problem, Carly. At least you understand. Okay. Okay, thank you. Okay, now we already completed the preparation, na? So preparation patient को तो बोल दिया that ऐसे वैसे means patient का relative को तो बोल दिया ऐसा करना है, and you already prepared the patient also. Now what do you need to see? What do you need to see? Articles. Okay, articles. बिना articles temperature check कर पाओगी? Can you check temperature without articles, without thermometer?
No, ma'am.
Then the CPR के लिए भी तो कुछ वो है ना? CPR is not only the rescue breath or the external chest compression we give ना, like उस टाइम पे भी हमको रेस्क्यू ब्रेथ वगैरह भी तो देना है ना, इन बिटवीन में माउथ टू नोज और व्हाटएवर वेंटिलेशन इज अवेलेबल, व्हाटएवर इट इज ना, कुछ एम्बू बैग वगैरह जो मास्क एम्बू बैग वगैरह अवेलेबल होने से वो सब देगा ना. So you have to have all those articles along with you, if especially in the hospital. So the next heading will be preparation of articles. Okay. Write down preparation of articles. Preparation of articles. Preparation of articles. So I'll just mention, okay, I'll give you all the notes, because if network is not good, then you can't follow also, na? So you just listen. So we will try to have tray, okay? We will try to have tray which contain following articles. And there are also some other tray that contains emergency drugs also, okay? So while preparing the articles, there are some like equipment. So that is endotracheal tube and all. I don't know whether you will know or not. Until you are exposed to hospital, you won't see, I think. So there is endotracheal tube also, which will need to be available in the tray. Endotracheal tube of different size का होता है. और एम्बू बैग सुना क्या? एम्बू बैग मार्क्स का साथ होता है, जो लाइक फिल्म में भी देखता है ना, जो वो जो एम्बू बैग जो मार्क्स से मुंह पे लगाते हैं, उसके बाद वो पम्प होता है, उसमें स्क्वीज करके like squeeze to three like this they used to pump and then they used to give oxygen. Have you seen in the movie and all?
No, ma'am.
Okay, well, no problem. I don't have the image. I'll try to collect the image and show you all so that like you all are more clear, na? That this is this, that, and that. Okay. Then a suction catheter is also needed. All this and all these things I'll just give you all if, because this one without image you won't understand, I think. No? Or else you'll just understand like this. You want image?
Yes, ma'am.
Yes.
Yes,
On my next class, I'll try to show you all the image so that like you are more clear. Okay, so but you write down some emergency drug, which is emergency drug. I want you all to know the some drug, okay, that need to be available in the drug. The like सांस लेने में जब problem होता है, ये सब CPR का time पे ये सब दिया जाता है. Just write down tray containing emergency drug. Tray containing emergency drug. एक tray होगा जहाँ पे emergency drug available होगा. Write down. Write down. Are you ready to write? All of you? Bolo jaldi.
Yes, ma'am.
Okay.
Ma'am.
Write down.
Emergency drugs, ma'am.
Yes, tray containing emergency. Yes, tray containing emergency drugs. Number 1, injection adrenaline. Injection adrenaline. You want spelling?
No, ma'am.
Okay. Injection adrenaline. Next, injection you can write down short form INJ. Injection adrenaline. Number 2, injection atropine. 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 Next, injection digoxin. Write down nicely, okay? I won't send the notes of this. These are just the extra things I want you to know. Injection digoxin. DIGOXINE. And then write down injection sodium bicarbonate.
Ma'am, number 3.
Number 3 is injection digoxin. The spelling is DIGOXINE. Digoxin. Digoxin. Done?
Yes, ma'am.
Okay.
Yes, ma'am.
Next is injection sodium bicarbonate. Injection sodium bicarbonate. Sodium. SODIUM. Bicarbonate. BICARBONATE. Sodium bicarbonate. Okay, next. Injection dopamine. Injection dopamine. The spelling is DOPAMINE. Dopamine. Can you follow me?
Yes, ma'am.
Okay.
Yes, ma'am.
Next, injection decadron. 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 Injection decadron. Next, injection Avil. 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 Avil तो सुना होगा. Injection Avil. 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 Next, injection Lasix. Injection Lasix. LASIX. Injection Lasix. 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 Injection Lasix. Have you heard the term Lasix?
No, ma'am.
Yes, Lasix. Lasix is very, very important drugs for to know if you are a dialysis student, okay? Because Lasix, we also call it as furosemide. The other name is furosemide because when our kidney doesn't function properly, and at that time, what happens is that किडनी से ही तो हम लोगों का वो होता है ना, like we all the waste product are excreted, is not it? So जब like when our kidney doesn't function properly, there is accumulation of fluid, okay, in our body. So at that time, in order to remove all the fluid that are present in our body, we used to prescribe a drug which is known as Lasix. Okay, Lasix का दूसरा नाम furosemide है, उसको diuretic बोलते हैं. Are you clear, all of you?
Yes, ma'am.
Okay, injection furosemide. Okay. Okay, next
Ma'am,
write
number
down.
9 क्या बोला?
I did not count the number. Actually, I am giving from here and there, here and there. So after what? Tell me, after what?
Number 8 is Lasix, ma'am.
Lasix, na? Injection Lasix. Okay. Write down number next is injection calcium gluconate. Injection calcium gluconate. GLUCONATE. Calcium gluconate. Injection calcium gluconate. Next, write down injection deriphyllin. DERIPHYELINE. All together, okay? DERIPHYELINE. Deriphyllin. How many drug I have given?
10, ma'am.
Okay, right, etc. Because there are so many drugs. So these are some of the important, because when you go to hospital, like you will directly see all these atropine, digoxin, adrenaline, all these. So if you want to know details about this, is like you just tell me, okay? I'll teach you all about this. ये adrenaline क्या करता है, atropine क्या करता है, digoxin, okay? What are the dose, what are the road, okay? What are the side of giving, everything, all this, because all these are mainly studied in pharmacology, okay? All these things. और अगर ट्रे में अवेलेबल हो तो तुम लोगों को भी हमेशा जानने का कोशिश करो कि whatever articles you are taking ना, or whatever drug it is, so ये ड्रग मैंने लिया, ये ड्रग क्यों देते हैं, हमारा like शरीर में क्या इफेक्टिव होगा, क्या बीमारी के लिए देते हैं, all this, like you always try to know and always be concerned about this. Okay, and then like I'll send you all the photo of articles, okay? And even the steps of steps I'll give you all the like photo, because it's very many the steps. So write down the steps of procedure. I will not dictate, I'll send you all the photo. Steps of procedure. Finish the heading?
Yes, ma'am.
Okay, the step that I will be giving you all, try to write down in the practical copy, okay? It is in a box. One side step likhna, one side rationally. वो BP का जैसा वैसा लिखना. And on my next class, I will explain to you all. Only this is the remaining. Then after that, we will complete with this topic. So you are clear now? Till now, whatever we have discussed, everything.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. Okay. Okay, then I think you all also will want to take rest now. So take a bit rest. Again, you have afternoon class, I think, with your other ma'am and all. Okay, then. Okay, then that's all for today. Okay, thank you, everyone. Have a nice day.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.